Okay. Okay, Katina, are you seeing the correct?
Can you flip it? The notes are here too.
Yeah.
All right.
Great.
Well, thank you all for being here this morning. We're going to talk for about an hour about organizational health literacy, particularly in the context of COVID-19. And our job always is to think in terms of strategies and tools to improve health literacy on an organizational level in this case. Hi, Lisa. It's not, okay, we'll see now. Did you hear any of my introduction before it moved me on and off mute?
I heard you.
Okay,
Yes.
wonderful.
Yep.
Lisa, it won't let me move. You're going to have to advance slides. I'm sorry.
Okay.
Every time I click, it just, oh, there it is. Okay, working now. So just as a reminder for everyone, this talk is supported by the program, supported by the Office of Minority Health as part of the grant that's referenced here. And the contents are ours. They don't represent the official views of any of those government agencies. And today your speakers are myself. I'm Katina O'Leary. I'm the president and CEO at Health Literacy Media, and my coworker, Lisa Carey. You'll hear Lisa join in and speak in just a few minutes. And as we always discuss, we want to make sure that there are ways to participate that are very clear. So first, we invite you to turn your camera on if you choose. It's always nice to be able to see folks' faces and know who we're speaking to. I appreciate everyone who's done that. We'll be monitoring the chat box. There may also be some Zoom polls along the way. In this particular training, I don't think we have any, but the chat box is definitely active. At any point, if you want to speak, you can unmute yourself to answer or ask a question. And you can also use the reaction buttons if you choose. After the workshop, we will provide a post-workshop survey. You'll see that in your email. And we appreciate anything that you can tell us to make sure that we do this well when we continue on with future trainings. So today we really have just a couple of goals. We're going to talk about organizational health literacy. Then we're going to talk about how to improve organizational health literacy, and then we'll share some resources with you. And so we've talked many times before about personal health literacy. I think everybody probably has a fairly good understanding of what this is. But for the purpose of this training, just making sure that we're all on the same page to start. So when we say personal health literacy, we're thinking about the degree to which individuals have the ability to find, understand, and use information and services to inform their health-related decision and actions for themselves or others. So that's really important. It's what's in our personal power to do for our own self, and our abilities to find, understand, and use information and services are all impacted by a whole bunch of factors that we've talked about before. But from an organizational perspective, which is where we are focused today, this is about how organizations equitably enable people to do those things. So it doesn't matter often how health literate an individual is, if they're brushing up against organizations who aren't helping them find, understand, and use information and services, that's a problem. We're going to talk about a lot of examples, but I think from your personal lives, you all probably have examples of getting information about an appointment, for example, in a health system where the instructions aren't clear and you can't find your way. Well, if you can't get there to get to the appointment, finding, understanding, and using information and services is obviously going to be a problem. So that kind of example is good just to get your head wrapped around what organizations can do and what they often don't do, what we don't do to make things clear. So this is really a shift in focus. It's so easy to think about the limited skills of millions of people. This is a great quote about this, right? It's so easy to think about what people can do and how they cope with their health literacy tasks. But if we shift our focus to the healthcare system, there's a really different picture. And maybe the data don't suggest that nearly 90% of US adults lack skills, but instead that the healthcare delivery system is not easily used by 90% of the people it's supposed to serve. So this is not about us as individuals failing. It's about a system that's not built for our easy use. And if we can shift that focus and shift that frame, it becomes really logical to start making different decisions about what we do in our systems. We want to make sure that we're starting to think about, again, what are the opportunities for health literate systems? So first, we want to highlight the 10 attributes of a health literate organization. This comes from a paper published by the National Academy of Medicine Roundtable on Health Literacy, and it lays out all the attributes of a health literate organization. We're not going to spend our time today going through these 10 attributes because instead we're going to use another resource that's more of a strategic toolkit. So we'll focus on that instead. But just to get us started, I want to share what these are. So you see on the screen that health literate organizations have leaderships that make health policy and health literacy a priority. They integrate health literacy into planning, evaluation, safety, and quality efforts. They prepare the workforce to be health literate and monitor progress. Health literate organizations include consumers in design, implementation, and evaluation efforts. They create a shame-free care environment to meet the needs of patients with a range of health literacy skills because we're not all the same ever. They use health literacy strategies in interpersonal communication to ensure and check patient understanding. They ensure easy to access health information and services and navigation support. They design and use information that's easy to read, understand, and act on. Health literate organizations address health literacy at high risk points. So in this case, we talk about transitions in care, medicines. But again, thinking about COVID-19 is a really good example because there's a lot of risk in the community, lots of high risk opportunities as we think about whether or not people are going to get the new booster, for example. It's a really important time to assess health literacy and start to address people's understanding of information. And number 10, health literate organizations communicate health insurance and health care cost clearly. So if people don't know what things cost, they really may have challenges. Another really important consideration that we want to make sure that we're paying attention to is the CLAS standards. So throughout training today, we'll talk about these standards for culturally and linguistically appropriate services. These are strategies from the U.S. Department of Health and Human Services to improve quality of services provided to all people. And this ultimately helps reduce disparities and achieve healthcare equity. So there are many places to learn more about the CLAS standards, but we'll be talking about that a little bit. And our job really is to provide services that are effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural beliefs and practices in preferred languages, meet health literacy obligations, and all other communication needs. So if we're putting that at the forefront, this principal standard really guides most of our work. So just for a couple of minutes, let's chat about the health literacy barriers you see in navigating our understanding of health systems or organizations. This can be personal or in your work, but what pops to your mind as we start to talk about health literacy from an organizational perspective and its impact on people? Anybody see this ever happen, that there is a barrier to health literacy that an organization is involved in?
I work in refugee resettlement, and we have a lot of different case managers in different departments. And I think we see often that like maybe not understanding medical bill follow-up procedure, or like how to navigate the hospital systems as a barrier that we're working towards improving services for our clients and improving our organizational health literacy.
That's a fantastic example. And I love a lot about that example, but particularly if people don't understand the billing and they don't follow up and pay the bills in the way that they're obligated to do, it can really affect lots of things in their life, right? They can get, things sent for collections, and it really impacts their ability to find housing. And there's all of these consequences to a simple theoretical problem that people don't understand. Someone says in the chat, not knowing how often to take a medicine or what to do if a dose is missed. And the systems don't always make that information clear and accessible either. That's a really good example as well. Does anybody have one more example of an organization challenge? Oh, I'm seeing lots in the chat now. This is good. So understanding new COVID guidance for school and work, when to test, how often, when to get boosted. This is a great example. My 10-year-old had a runny nose today. What does that mean for going to school? Doesn't mean anything right now. Previously, it wouldn't have meant anything in the fall. People talking about constant focus on self-care, thinking about what our obligations are as individuals. I love that example that organizations have downloaded care to the individual, and we expect everybody to know what to do. There's a discussion about youth, language barriers, difficulties getting vaccine evidence, not knowing what an organization has to offer. They don't know what services are there, and in many places besides the thing they use. The wait times for screening is huge. People aren't aware of where else they can go. So this is a great set of examples of the barriers that organizations put in place. And just keep those in mind as we continue to talk. I'm going to let Lisa move on to the next section where we really start to talk about strategies to improve organizational health literacy. Lisa?
Okay. Thank you. Yes, so that's what we'll be talking about. There are 6 key areas for improving organizational health literacy, and let's go ahead and move through those. So this is a great resource for organizational health literacy. It's a UnityPoint Health Guidebook, and gosh, I think it's 80 some pages. It's pretty extensive, and really a good resource. So we're going to use this guidebook today as a framework. It's a really comprehensive guide to improving organizational health literacy. And it was made by UnityPoint Health in Iowa. I don't know if you've ever heard of that, but leading experts in the field of health literacy. So the 6 key areas for improvement are engaging leadership, preparing the workforce, the care environment, involving populations, verbal communication, and reader-friendly materials. And so we're going to talk about 4 of these areas. And for each of these areas, we'll discuss sort of the why, the what, and the how of each area. And so the other thing that I want to do is I'm going to put in, let's see now. I need to put a link for you into the chat. And this is let's see here. Sorry about that. This is for you to go ahead, and we have an activity sheet here at this link that you can download and actually, type in or print out and write your own information as we go through these. And let me know if anybody has trouble doing that. So hopefully, okay, I'll go ahead and move along, but yeah, this is about the activity sheet. Okay, so kind of step 1 from this guidebook would be forming a team. You don't need to go it alone, and it's much easier if you can get people from your organization to join you in this health literacy effort. So consider forming a health literacy team made up of key stakeholders, which may include, diverse staff from your organization, patients and their families and caregivers, maybe community representatives. They will really help you identify your organization's health literacy priorities, and then together you can establish your aims and goals. And another really great resource is the Health Literacy Universal Precautions Toolkit. And I believe that's from AHRQ. It's a useful tool on how to form a health literacy team, along with a number of different tools and resources and tips and testimonials. And you'll see we have the link underneath there, so you can access that. Okay, so engaging leadership. So why do you need to involve leadership? Of course, we know that organizations with if the leadership is behind something, then it's much more likely to get done. And organizations with the most successful health literacy programs really have senior leadership who are champions of this concept. In fact, one of the authors states that the difference between having support and not having support is like trying to dig a hole with a backhoe versus a tablespoon. So, if your leaders can recognize the importance of clear health communication and strategies, they can remove barriers to allow this work to happen. They can hopefully provide you with the time and money to push your initiative forward, and also raise the visibility of your health literacy work so that others see what you're doing and get inspired, and maybe get inspired to help in the effort. So kind of the what of engaging leadership is, it might look like many different things, but some examples would be like if your CEO integrates health literacy into the strategic plan, maybe an executive director models plain language with staff and community members, and clear communication, maybe being included in your job descriptions going forward. There are many other ways to go about engaging leaders, and this is kind of the how. Maybe educating on health literacy, such as data and the business case for health literacy. And certainly, if you need help with that, contact us and we can definitely help you. We have data on the business case and why it makes so much sense for the bottom line, as well as being the ethical thing to do. Having a plan ready when you approach someone, and to start, with small goals first and work your way up. Next, having ideas for how the leader might help, and then checking in often to report on your progress and things that you need towards your effort. Okay, the second area is preparing your workforce. To be a health literate organization, everyone on staff needs to be trained in clear health communication skills. Knowing is not the same thing as doing. So getting this training to administrative staff, program staff, other roles who might communicate with your clients, such as people at the registration desk, housekeeping, transportation staff, maintenance staff. Getting everyone involved really helps this, become more successful. So let's see, here's an example of a call center training from United Healthcare. Their director, I think it's their director of Senior Vice President for Consumer and Customer Experience, said, we give our call center training staff big, thick cotton gloves and ask them to open a pill bottle, or we take glasses and scratch them so they cannot really see through them, and have them try to read the label on the pill bottle. That is the reality of the individuals that they will talk to on the phone. And so this is kind of a creative approach that really helps put their staff in the shoes of the people they will be serving. And that's something that health literacy is really all about. It's putting yourself in the shoes of those who you are serving and seeing things from their perspective and what's difficult. So training for your staff might also look something like direct observation and coaching to form new health communication habits, training them on how low health literacy plays out in your own setting, training them on communicating clearly with staff and clients, or training on when a system change might be needed to fix a systemic barrier to health communication. So it sounds like, from the chat, when Katina was talking with you about barriers, it sounds like a lot of you are already, trying to work on barriers and overcome those. So that's great. Okay. Second, preparing the workforce. When planning trainings, look for opportunities like those that are listed here on the slide to connect whenever you can, such as maybe grand rounds, orientations, department meetings, or performance reviews. Training staff on clear communication can really help you, meet continuing education needs. That's a good one. It helps you comply with guidelines and regulations, and frankly, just improve care and outcomes for the people you serve. All good reasons. So moving on, let's see. This third area is, it's improving the care environment. So this, might be around hospitals, or it could be, just the care environment. If you have clients coming to your agency, we'll tell a story here about how that sort of care environment impacts the patient or client experience. So here we have Marie, a 35-year-old female who primarily speaks Spanish. She's pregnant, she has asthma, and she just scheduled an appointment with a neurologist for severe headaches. Okay, so she was emailed the intake form in English, but she doesn't have a printer, so she filled it out on her phone. But on her phone, the small print was hard to read, and she didn't really understand some of the terms. She guessed or marked no for certain conditions like pregnancy or asthma. And then when she arrived at the clinic, she entered the main building, and after searching for the office, she finally found a housekeeper who told her that neurology was in a different building way across campus. Finally, she found the office. No one really greeted her, so she sat down and just waited to be called. 20 minutes later, she asked the receptionist, who told her to sign in and wait. Okay, and then once she was in the room, the doctor was another 20 minutes late. The doctor, who spoke only English, spoke quickly and did not make eye contact. She struggled to follow the doctor and felt afraid to ask questions, and so she remained quiet for most of the visit. So, this is a clinical example, but it could be applied to really any setting. So we want to hear from you. What are some of the things that went wrong here? And, where could improvements be made to create a more friendly, safe environment? And you know, feel free to write in the chat or to unmute. What were some of the things that went wrong here? Okay, the doctor didn't use teach back. There was no interpreter for the patient. Translators should have been there, yeah. Have forms available in multiple languages. Carol says finding out preferred language when scheduling the appointment. No clear signage that offered multiple languages. Great. Yes. You know, as we know, our society here in the US is becoming more and more diverse in terms of languages, maps and directions prior to the appointment, and absolutely no bedside manner from the doctor, a failure to be acknowledged at the doctor's office. She needs to find her voice and not be fearful for her own health goals. Right. So that's, you know, we can say that to find her own voice. And part of the beauty of health literacy is that it does in making materials more clear and training staff to really recognize people who need extra help or who need any kind of help. You know, it really can help empower patients. The system can help empower patients. Yes, exactly, Brenda, great minds. The form wasn't formatted to be used on a cell phone. Yeah, so there was just a whole variety of, you know, mechanical difficulties, language difficulties, time management, when says assumption that patients have digital literacy and access. Yeah, so all of these things. And if you look at this UnityPoint guidebook, they really address the whole, you know, array of barriers and problems that you can work on, and, you know, make sure that, or at least strive to make sure that these barriers, you know, are lowered or don't exist for the people you serve. So great, thank you. All right, so what does a health literate, like, shame-free environment look like? And so here's a little checklist that we have. And it's things like all clients greeted with eye contact and a smile. Also, all clients offered help with paperwork. Clients and families know that questions are welcome and expected. Staff are trained to spot signs of low literacy and when help is needed. Materials and websites are easy to read, understand, and use. Signs and wayfinding tools are easy to use. Wayfinding meaning, you know, finding their way to and through your facility. Facilities and materials are easy to understand for people with disabilities and who do not speak English as a first language. Trained interpreter services are readily available. And all staff are trained on cultural sensitivity. Clients' culture is weaved into policy and practice. So these are all great goals to strive for. And, you know, hopefully some of these things are already happening at your agencies or facilities. The fourth key area is involving the people you serve. So involving patients, their families, their caregivers, adult learners. It's an important way to meet the needs of populations with a range of health literacy skills. And it's really basic to patient-centered care. So here's one way that we here at HLM kind of did that. This is just one example. We created this guide with a partner, UCLA. And this is a guide for patients with kidney disease who often have weakened immune systems. And we did this sort of around the start of the pandemic in 2020, because these patients either, are maybe waiting for a kidney transplant or have had a kidney transplant and are taking those medicines that really, tamp down their immune system. So of course they were in a panic about getting COVID. And so to ensure that this guide, included what was really needed, the information they wanted, a group of kidney patients submitted questions to include in the guide. And then they also reviewed the content to make sure that it was understandable to them. And that's one of the things that Katina is going to talk about is, patients and their families usually know what they need, and they can tell you what they want. So involving the people you serve, and at HLM we do a lot of audience testing for many different materials, and for your purposes you can test materials with usually about 5 to 8 people from your intended audience. And the audience testing really is sort of the gold standard for ensuring that your materials are suited to your intended audience, because they can tell you what parts of your communication are helpful, what parts are confusing, and if any important information is missing. Testing can include focus groups or one-on-one interviews or even surveys that you send out. And, we realize that not everybody can use formalized testing, but, at the very least, if you've developed a new material or maybe you're considering revising an existing material, try showing the materials to someone who's not familiar with the topic, someone who doesn't already know the information that's in there. Could be a colleague, someone at home, or, a friend or neighbor, but, getting a reaction from at least 2 to 3 people will really help. And you can ask them questions such as, what parts are hard to understand? How would you make this better? What are your thoughts about how it looks? What questions do you still have after reading this? And what would you change? And you'll get some really great answers. Okay, so here we have a Zoom survey. And let's see, I'm going to go ahead and launch the survey. Okay. You should see a poll popping up on your screen, and you can choose the top 3 of these. Are people seeing this? Okay, great. Okay, now I'm starting to see some results. Okay, we'll give you another little while. It looks like almost everybody has answered. And then we'll show you the results. Okay. All right, I'm going to go ahead and end this poll. Thank you to everyone who. Okay. So here are the results. How could you involve the people you serve? And it looks like clients help develop written and digital materials. Got 62%. What else? Community stories and recommendations are included. Got 55%. Then let's see, it looks like staff know how to make referrals to adult literacy programs. Clients are asked to tell their stories. And clients serve on key teams. And then navigational audits, that's that wayfinding to improve navigation. So great. Interesting. All right. So this is a way to sort of get you started thinking about how you can start, pulling health literacy into your own organization, and hopefully you get a chance to use your activity sheets. We have these last two key areas that are both focused on clear communication. And, communication is especially important during COVID because people are just getting so much information. It's been termed an infodemic. So an infodemic is when too much information, including incorrect information, is spread during a disease outbreak. It can cause confusion and risk-taking behaviors that impact health, and it can worsen and lengthen the outbreak due to faster moving and greater amounts of information. Has anyone heard this term before? Even if you haven't, we're sure that you see the effects of this in your work.
Yeah, hi, this is Connie.
Mm-hmm.
I was going to say I haven't heard that term, but you're right. We've certainly seen it in dealing with a lot of communities and on TV and, through the politics and everything that's going on.
Mm-hmm. Yes. Anybody else? Seeing this, or have you had actually experienced clients who you're serving who have actually come in with misinformation that you needed to correct about COVID or vaccination? Okay, Allison says, I had heard it but didn't know what it meant. Yeah. There are lots of terms that we're learning with this pandemic. Okay, well, I'm going to go ahead and move it back on over to Katina to move us through our next section.
I keep muting myself and forgetting. We have a little exercise now just to remind us about verbal communication as one of the key strategies here to make things more clear. We often communicate with jargon, and jargon is language that people have to have experience in the health field to understand in this case. And so we learn things in school. We're trained to communicate with other health professionals, but when we communicate to a community or patient audience, they may not have the same framework. So here are some examples of things that people might say with jargon, and we want to think about how to avoid that and speak without jargon like we would to a parent or child. So something they might hear with jargon is watch for symptoms of strep, bacterium infection, including pharyngitis, tonsillitis, and pyrexia. How would you say that without jargon?
without jargon,
How
You
can we
could
make
say-
it clear? Yeah.
you could say, watch for symptoms of strep, including sore throats, and really sore throats and swollen tonsils.
And oops, I did too. I'm sorry.
Oh, and a
so-
fever. Okay, forgot about that.
Yeah, so pitch perfect though. So that this is a much simpler way. Watch for signs of strep throat, such as sore throat, swollen tonsils, and fever. People would understand that much more clearly. Another jargon example here is your daughter febrile? The without jargon version is already showing just do they have a fever? Much more common language that people would understand. And then one more jargon example, adverse events after vaccination should be reported. What do you say without jargon?
Hey, let us know if you feel bad after you get your shot.
Please report any reactions after you get your vaccine. And your example is really good as well. Just that communication that we're aware things might happen and you should let us know. So these are great examples of how we communicate with other medical professionals, but it doesn't connect with the community. Anything we can do to avoid jargon makes it easier to ensure that the patient understands the information. And that's particularly important during the infodemic, right? As we go through this pandemic with so much misinformation and so much information that is a challenge, anything that we can do to make it clear and simple is important. Another strategy, the fifth one here, is to talk about teach back. We can't have a training without reminding folks about this. This is a method that builds in checkpoints to make sure clients are actually understanding everything you're saying. It works great when you're teaching new information that involves several steps, like how to quarantine after exposure to COVID or when to get a COVID-19 booster shot. So you can see here in the chart how teach back actually works. So the first thing that you do is explain a new concept, being careful to only explain one concept at a time. And then you ask the person to explain it back to you. So if they are able to explain it back correctly in their own words, and you have more information to teach, you can explain the next concept and continue on. But if they don't explain it correctly, you need to go back and explain it again. And here's the trick. You got to use different words or visuals to explain again, because just speaking louder doesn't necessarily help people understand better. So we're going to try again using more clear words, maybe draw a picture, use some visual tool to help them, and then ask them to explain it again and keep working through it until they're able to do so. And once a person's able to explain it back to you, you can feel reasonably confident that they understand it and they're able to sort of lock it in and remember what they're supposed to do. So often we practice this. Today we don't have time, but you can certainly check out teachbacktraining.org to learn more, and we'll share these slides to remind you of that opportunity. Then the final example that we want to show you today is focused on reader-friendly materials. Does anybody know what this says? Anybody? I
No.
wouldn't think so, because it's written backwards. So this is what it said when it's written correctly. So very simple instructions to go through a process. But when it's written backwards, every word, all of us in this room have trouble understanding what it is, and we're not able to process and find the information and use it to follow instructions. So imagine how hard it would be to have materials that you need to process and understand for your health that looked like this to you. Imagine if you needed to get something out of the gobbledygook in the blue box. The reality is that's how it might feel to readers who are low literacy, people who don't have strong reading skills, but also people who have vision problems, language barriers, people who don't speak English as their first language when we rely on English in the medical system often. So they're looking at things that look like this paragraph and they're not able to make much sense. Much of our contact with public health system and health system is through the written word, and it's very often not a match for what people's skills are. So we need to really do a good job, a better job of creating materials that work for folks. Here's an example from some of our work in creating reader-friendly materials. What do we do to help? We use plain language, and we've talked a lot about plain language over the course of these sessions, so you might have heard this before, but just as a reminder, plain language is writing so your intended audience can understand the message the very first time they read or hear it. And there are lots of tools that we can do to use plain language beyond just the words. So here's an example of a fact sheet that we revised on action steps if someone tests positive for COVID. So you can see, first of all, that we added color, icons, and graphics to make it stand out to the intended audience, and also to organize the content. So it helps people sort of guide their eyes through the process. The icons for people who don't have a strong reading skills, it helps them understand what words connects to the images so they can follow along. We use consistent headings and bullets throughout so that people can navigate. Again, they know where the paragraphs break and they can see like information together. And we organized all the points so the action steps were really clear. So on this material, there are 5 action steps that they're able to see if they go through the material. People manage health conditions and they make health decisions mostly at home, work, or school. So any of these printed and digital materials are necessary to support their decision-making as they process through. When we create materials that are health-friendly, reader-friendly, they address disparities, health equity, cultural sensitivity, and accessibility by thoughtfully making content that they can access and understand. So many times this includes translations, but we also need to think about cultural beliefs, any kind of devices that people might use like screen readers. Incorporating all of those resources into materials is really critical. There are lots of tools for this. In addition to the guidebook we have, the CDC has a clear communication index that folks can use and things like that. So again, we've covered 6 areas today. Oops. We've covered 6 areas for improvement today. We really love this resource. Folks in Iowa made this, and it really is intended to operationalize organizational health literacy and walk people through the 6 areas. They're here and articulated for you. But you can use this book again in your groups, your toolkits to think about what do you do in your organization to do a better job. We don't have a lot of time to go into small groups, but here as a big group, let's talk about what your ideas are for improving your organization health literacy based on what you've learned today. And we've got the chat open, as well as you can open your mic and speak too. What would you do to improve your organization's health literacy?
I think I want to start by the first step of like engaging leadership. And then my first thought of what we could do is maybe survey our staff to see like how comfortable they're feeling with certain topics.
Really great ideas. Absolutely. I see some notes in the chat too, hiring people who speak languages that reflect the audiences you serve, and encouraging folks to take cultural competency courses. Someone says recruit health literacy champions. That's a really good idea and a way to get things started in any organization. Are there other ideas? Engaging existing patient education department and leveraging their expertise. That's a really great idea too. If you have existing patient education departments, talking with them, many times these groups aren't thinking a whole lot about health literacy because they have other obligations to legal and other groups. And so helping them realize that patient engagement is also important for materials, and the education certainly still has to meet legal requirements and brand requirements and marketing and all these things, but making sure it's understandable and accessible is really important. I see someone says go back and reevaluate all information to the public and see if wording can be improved. So just really do an audit of what you're putting out there, and is it acceptable? Does it meet the guidelines and the requirements that you need to meet for your intended group? Someone says integrating health literacy into planning and evaluation measures, critical. And then we see the comment that the workforce is really critical. So training the workforce is a major one, making sure that we're using the words together and thinking about health literacy as a tool, and not just a tool to strengthen individuals' personal reading level, but what do we do as organizations to make this work better for everybody? Embedding policies in processes, partnerships with libraries, community outreach, absolutely. Meet the needs of populations with ranges of skills. These are so many ideas. People are really, really on fire here. So thank you so much for those. Let's keep up the discussion together. I know that the next, we're nearing the end of our training. There's one more slide on resources here that we want to share with everybody. So set of resources, and again, we'll share these slides so that you have these. The guidebook really is a tool for organizational change. Oops.
Sorry.
No, it's okay. It keeps doing it to me. So this guidebook is a really great tool for organizational health literacy processes. The Health Literacy Universal Precautions Toolkit is fantastic. The National Action Plan to Improve Health Literacy is a good government plan that came together many years ago, but it lays the foundation for using plain language and assessments and some things like that that are important. I mentioned the CDC Clear Communication Index, and we talked about the CLAS Standards as well. So there are some good sets of tools here for your further reading and understanding if it's helpful. So what questions do you have for Lisa and I or the group today? We have about 5 minutes left if anyone has questions.
Okay, I think I see a question in the chat. Are any of your resources speaking to mental health?
These particular resources on the prior page aren't directly focused on mental health. We did create some resources a couple of years ago that are focused on mental health with our partners at Truman Medical Center. So we do have some health literacy resources in those communities. And the thing I would say specific to creating opportunities for more health literate materials with specific populations, particularly folks who may have mental health challenges or cognitive challenges, is that this is a really good opportunity to include patients from the key audience in any communication to really assess their needs, but also their care partners and their healthcare providers to think about what they need. When we made the materials with Truman, we did this several years ago. One of the things that we asked healthcare providers are, what are the conversations that you're having over and over again? And if you're getting the same questions consistently and you have to remember how to answer them, or you're having that conversation a lot, that's the time to really think about whether a material is helpful and whether it's useful to take the questions you're hearing from your patient population, put them on a material using health literate language, provide the questions and the answers, so that you're consistently saying the same thing, but also so the patients and their families can take it home with them and use it as a resource as they go along. So I think there can be much, much more to benefit that particular community audience.
And we did develop some mental health materials with the health department. And there was a training, I believe, 2 months ago. So that would have been in July. I think it was maybe number 7 of this training series. And we did record that training. So you might want to check that out. I'm not sure if it's up on the health department website, but I know they have plans to do that. So let's see, here's another Susan says organizational cultures can be very difficult and slow to change. Are there ways to talk about organizational health literacy in ways that will convince administrators, stakeholders that are important outcomes in becoming more health literate? Katina, would you like to speak to that?
Sure. So we agree. We think, when we work with many large organizations, we see that, it's a really slow shift often. But, we've been successful when we link health literacy with equity. So many organizations and departments have a requirement, an internal mandate already for equity and diversity, and they don't always know what to do toward those mandates. So health literacy often gives a set of tools that makes it possible for them to meet some other obligations and some other mandates. So that's one thing we do, is we link the two of those together, which can be really helpful. The other thing is we remind people that there are legal requirements. So using the CLAS standards, for example, is a legal obligation. You need to provide materials paying attention to the CLAS standards, for example. So we need to think about language inclusion and access. So, those examples where we're providing materials only in English and the communities we serve don't have translators and they don't have materials in their preferred language really is, a risky proposition. And so from an organizational perspective, if you're not thinking about that, you could find yourself in some pretty deep trouble quickly. And so I think when you talk about those things, it moves people a little further along to some actionable items. So we think about that a lot. And then the other thing is many of these health literacy strategies are very affordable. So thinking about, somebody mentioned getting health literacy champions. You can do that for free. You can get a group of people who care about this, who are serving patients, who are worried about this problem. Think about bringing your lunch and doing a little brown bag together and talking about simple things you can do together is one strategy to at least get the ball rolling and create some internal sort of momentum toward this. Carol mentions linking health literacy to safety and safe communication as well as equity is a good strategy. And that's exactly right. Safety, if somebody doesn't take medicine correctly and they have a problem as a result of it, if you haven't provided the information in a clear way, there is some responsibility. And whether that's a legal responsibility or not is a different question. But personally, we want people to get the information they need so that they can be safe and take their medicines correctly and be well. So thinking about equity, safety, quality, all of those components, as well as the mandates to have clear language and translators and interpreters and all those things, are ways to get key leadership on board.
Okay, I think we need to go ahead and end our session today. Thank you so much to everyone. And please note that in the chat, I put a link to a very short survey about the training and what other topics you would like to hear about. So please give us some feedback and have a great rest of your day. Thank you.
Thank you, everybody.